Tes, tes. Suara saya terdengar ya Pak Jamal? Baik, kita mulai. Good morning, the Honorable Prominent Speaker, Professor Govinda Niranjana, SRM, Institute of Science and Technology. We also acknowledge and welcome Director of College of Health Science of Soetomo Hospital Foundation, Dr. Gigi Widya Astuti MK, Vice Director for Academic Affairs and Quality Assurance, Muhadi SKM MKes, Vice Director for Official Resources Management and Finance, Dr. Anik Prasetyo Rinit SKM MKes, Vice Director for Student Interests and Talents, Alumni.
Let's go on. Let's go on.
Alumni and Management Information System, Dr. Eka Wilda Faida, SKM MKAS. This structural and non-structural official lectures, staff, students, distinguished guests, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
On behalf of the organizer, we would like to extend a warm welcome and express our gratitude for participating in guest lecture, which title is The Importance of Hospital Information System. Ladies and gentlemen, allow me to read the agenda for our opening ceremony. The first is listening to the Indonesian national anthem, Indonesia Raya, and will be followed by March of College of Health Science of Soetomo Hospital Foundation. The second is a welcoming speech by Vice Director for Academic Affairs and Quality Assurance, Muhadi SKM MKAS. The Honorable distinguished guests, ladies and gentlemen, now we move to the first agenda to honor our country. Let us listen the national anthem, Indonesia Raya, and will be followed by March of the College of Health Science of Soetomo Hospital Foundation.
Kesehatan, Yayasan Rumah Sakit Dr. Soetomo, membangun visi dan motivasi dalam pengabdian serta prestasi. Sekolah Tinggi Ilmu Kesehatan, Yayasan Rumah Sakit Dr. Soetomo, ciptakan teknologi kesehatan yang handal di Indonesia. Didik tenaga profesional, tingkatkan ilmu serta keterampilan. Dengan semangat Bhinneka Tunggal Ika, marilah kita maju bersama. Siap mengabdi dan membangun masa depan demi kesehatan atas sesama. Hidup terus jaya STIKES bagi bangsa Indonesia tercinta.
As the College of Health Science of Soetomo Hospital Foundation fully support this event, I would like to invite the Vice Director of Academic Affairs and Quality Assurance of the College of Health Science of Soetomo Hospital Foundation, and at the same time, welcome all the participants here. Mr. Muhadi SKM MKes to discuss.
Hello, good morning.
Morning.
Good morning, Madam Dr. Niranjana.
Morning.
Have nice to see you. Welcome to Indonesia.
Thank you.
How are you today?
Yeah, good.
Fine. Welcome to Surabaya, Indonesia.
Thank you.
Thank you for your time and opportunity, and thank you for your coming in Indonesia. We're very happy to nice to see you and to share about knowledge and experience with us. And I think it's the good change today. It's very special for today.
Yes, sir.
Thank you for attention. And today, Madam Dr. Niranjana, we have any participant, yeah, join to us 158 participant, and join to virtual participant from the any background, any student, lecturer, any practitioner and other stakeholder to want to hear your insight today. And today discuss about interest topic about the how to importance hospital information system.
Yes.
I think it's very the good idea, and Indonesia today to transformation and about digital transformation in health service facility and others place about the healthy. Uh, I think the time for to hear about your knowledge about the hospital information system. The participant and ladies and gentlemen, enjoy the listening and let's take the advantage to it. Thank you, Madam Dr. Niranjana, for coming. Okay.
Oh.
Okay.
Thank you for giving me this opportunity. I hope I will give you my best. Thank you.
Okay. Thank you.
Shall I start presenting?
Bu Titin, Madam Titin.
Yeah. Thank you, Mr. Muhadi SKM MKes for opening this guest lecture. Now a guest lecture which title The Importance of Hospital Information System is officially open.
Thank you.
Ladies and gentlemen, now we arrive at main agenda. For this moment, I would like to invite our moderator today, Amir Ali Eskom MCom.
Yeah, thank you, Bu Titin, Mr. Titin. Okay, ladies and gentlemen, may I have your attention, please? Our class in guest lecture is about to begin. Please have a nice seat, and thank you very much for preparing yourself to join our class in guest lecture. Assalamualaikum warahmatullahi wabarakatuh. Good morning, everyone. Respectable the chair of STIKES Yayasan Dr. Soetomo. This is Dr. Kiki Widyastuti, MKes, Vice Chairman, Mr. Muhadi, SKMMKes, Mrs. Anif Prasetyorini, and Mrs. Eka Wildafaida. And the Honorable Lecturer in Medical Record and Health Information and Hospital Administration, and the Honorable participant of this class in guest lecturer. Ladies and gentlemen, I'm Amir Ali, the moderator of today in our class in guest lecturer. I'm very pleased to see you here and welcome to all of you in this class. Today, class is about the importance of hospital information system. And before the presentation begin, I want to introduce the professor. Our speaker today is Professor Dr. Govindan Niranjani. Good morning, Professor.
Good morning.
She's a lecturer from Department of Computer Science and Engineering from SRM, Institute of Science and Technology, India. She is expert in machine learning, artificial intelligence, image processing, deep learning, IoT, and networking. She has written many articles in international journal and has been published, like the Smart Healthcare Monitoring System using IoT, that published in International Journal of Advanced Science and Technology. And she received many awards like IET Women Engineering Award in 2018, and many other achievements. Before the presentation begin, let me inform how the presentation will be going on. First speaker will be invited to present the material, and after that, there will be question and answer session, and followed by conclusion. Okay, now allow me to welcome the speaker, Professor Dr. Govindan Niranjani, to deliver his presentation. Times is yours.
Thank you, Professor. Thank you. Shall I start sharing the screen? Hope my screen is visible.
Okay,
Visible.
okay.
So good morning all. I really thank everyone for giving me this opportunity for presenting you this importance of hospital information system, and my special thanks to Dr. Inge Dhanmati for giving me this opportunity. So today my session will be about importance of hospital information system. Okay. So before getting into it, so what is hospital information system? Hospital information system is the way the things are getting recorded, like whatever the activities being done in the hospital, that will be getting recorded for future use. So that is said to be hospital information system. So according to Karam's rule in World Health Organization, it's the hospital information system is nothing but an integrated effort to collect, process, report, and use health information and knowledge to influence policy making, program action, and research. So according to him, hospital information system is a process of collecting the data, processing the data, and reporting the reporting and using the health information. And this information will be used by the other users, like whether the policy makers who are going to make the policy, or whether he is a researcher, so for making the future research in the given topic. Okay, for all these purpose, the data will be used. And according to Jack Smith, and he mentioned in his handbook Health Management Information System, he referred hospital information system as a set of interrelated components working together to gather, retrieve, process, and store and disseminate information to support the activities of health system planning, control, coordination, and decision making, both in management and service delivery. Like the same as Sakaram, he mentioned the same. But he mentioned that the process is actually is not a single process. It's a combination of subsystems. Like that, each and every activity is a single subsystem, and the collection of these subsystems will form the hospital information system. And the subsystems may include gathering the data, retrieving the data, processing the data, storing the data, disseminating the information to the relevant persons, and based on the information, processed information, proper planning is done, controlling, coordination, and decision makings are done, and also used for research purpose. So that is the use of hospital information system. So the hospital system sub-activities will be mentioned in simple ways, like maintaining the patient records, scheduling, administration, chargeback and billing, links to or includes clinical information such as RIS. So maintaining patient records is like whoever is coming in for the hospital, his details, his or her details will be saved. That is maintaining the patient records, like what is his name, what is his age, where he is from, and what is his basic problem. Okay, so all these things will be stored in the patient records. And next thing is that scheduling. So scheduling means, like, say for example, when the patient comes for the first visit, he will be allowed to do the next visit, but the next visit may be a week later or a month later or 4 days later, like that. And also, if more than one patients are coming to the particular hospital at the same time, then in that case, we need to schedule who has to go first, who has to go next, and what is his next visit date, everything. So that comes under scheduling. And administration. Okay, so administration means based on the population of the data, like how many people are coming for the hospital, and how many are waiting, and how long it takes, and everything. Based on that, the hospital infrastructure may be increased, or the number of doctors may be increased, or if it gets reduced, means you have to identify the problems, why the number of patients are reduced. So based on these things, the administration will be taken out. And chargeback and billing. So if the patient is an inpatient, then in that case, he or she needs to be, after completing the treatment, he or she needs to be, what is that? They get discharged from the hospital, and billing information. So all these things we can get it back from the hospital information. So apart from that, we can store the clinical information system such as radiology information system, where your scanned reports and scanned images are being stored. So these are some of the benefits of using hospital information system. So it helps the decision maker to detect and control emerging and pandemic health problems. Okay, like, so based on the data that is being stored, say for example, for a period of time, if more number of patients are being recognized with more similar kind of diseases, means then in that case, you can identify the pattern, like what kind of disease the people are getting, or is that specific to any area, region. Like that, we can take the decisions from the data. And next thing is the monitoring progress towards health goals and promote equity. Okay, so monitoring progress means like the public health progress should be maintained. Okay, like in other words, you can say that the fatal rate will be maintained, and based on that, the health goals will be set, and also promoting the equity. Say, for example, if some diseases are more affected by some group of people, then in that case we can concentrate more to the people, so that all will get the same same treatment and everything. And next thing is that empowering individuals and communities with a timely and understandable health related information. So based on the data what we fetched so far, we are going to empower the individuals. Like, say, for example, in the case of pandemic situations, the individuals are given alert that they have to sanitize themselves frequently, and also they need to isolate themselves if they find any comforts or like that. Okay, so these things can be done only with the help of the health information systems. And also it provides improvements in the quality of service. So it is a cycle. The treatment and the data collection process, treatment given, and the checking the condition of the patient is a cyclic process. Okay, so from one cycle to another cycle, it actually improves the quality of the service, so that the patient gets discharged at the earliest, and also reducing the number of fatal rates. The evidence also effective health policies will be based on the data, that is the evidence that is being given to them as input. So based on that only the health policies will be framed, and also any scale up efforts will be taken with the help of the evidences only. And also it enables innovation through research. Like, whenever the data is being given to the researcher, the researcher is allowed to identify the patterns that are being followed in the particular type of disease, and he can identify and give solutions, like why this sort of problems arise, and what is the solution for this, and everything. And finally, for improving the governance, mobilizing new resources, and ensuring accountability in the way they are used. So it will increase the governance of the patients, and also new resources. Like, if any equipment is required, any extra equipment is required, so that resources will be added, either a manpower or any infrastructure requirements. So everything will be taken care, and then accountable and the need to be checked whether the given resources are being utilized properly in the way they should be used. In simple words, you can say that the health information subsystems is a collection of these things. The first one is the data collection. So based on data collection is done at the initial level, like whenever the patient visited the hospital, then in that case the patient will be asked for his records, like his name, age, address, and then what he is suffering from, and everything. So that part is said to be data collection. So apart from that, the community health workers and health facilities like radiology and X-rays, CTs, PET scans, and laboratories. So from there also we can get the details. So apart from that, it can be used for program specific monitoring and evaluation. Like if there is any special disease, then that will be monitored with the help of this health information system. and administration and resource management. So this is another subsystem where it does not involve any patient, but the patient count and the patient requirement is taken into account for administration and resource management. And next thing is that disease surveillance and outbreak notification. So this is used by the public health department, where you can see like chronic diseases and other outbreaking diseases will be maintained as record in the public health department, and the diseases based on the history, they can reveal the outbreak notification. And next is that data generated through household surveys. Sometimes household surveys also works well for health information systems, and also the registration of vital events and censuses like birth rate, death rate, and the causes for the death. So all these informations are used, like we cannot do all the process as a single process. So all our subsystems, we can do it as separate subsystem, and then we can integrate as the hospital information system. So here you can see that it's a combination of medical information management, laboratory management, patient registration, appointment management, staff management, and more. We can define the hospital information system in simple terms. Hospital information system can also be referred as health information system, where the purpose is to manage the healthcare data. So in its simple, you can say that collecting the data, storing the data, managing the data, transmitting the data from one hospital to another hospital, and then using the data, we are going to make the policy decisions, and also automating the EMR records for administrative and inventory functions in the organization. So this hospital information system maybe can be used in the form of a web application, or it can be used as a mobile application, or wherever you want. In its easiest way, you can have it. And it acts as the centralized database for where all the information related to patients, doctors, and staffs are collected and stored. In case the hospital is having multiple branches, then in that case, a centralized database is required where all the information related to patients, doctors, and staff are stored, and thereby, whenever required, the centralized person, like the top management person or the user, can get the details effectively without any waiting time. So the activities of the HIS include that to handle the data, to the activities of the providers and the health organization, and also it improves the patient outcomes by informing the research activities, influence policy making according to the scenario, decision making, because health information commonly access, process, or maintain large volumes of sensitive data. Security is a primary concern. So whenever we are talking about the process of the HIS, you can say that security comes a trade-off with the maintaining the data. Okay. So now we'll discuss how the ICT tools are used for health information systems. So what are ICT tools? ICT tools are information and communication technology tools. So actually they play a crucial role in the healthcare sector, improving the patient care efficiency and other things. And if you see this here, according to World Health Organization, this is the per bed ratio for hospital bed ratio per 10,000 population. Here we can see that the Asian and the European countries are more highly affected than the rest of the part of the world. So here you can see the dark region mentions the population, like hospital bed rate is more here rather than the other areas. So it is necessary that we need to maintain the records of the patients, and we need to maintain the information about the diseased people, and based on that you have to make the policies, and also the administration can be done based on that, and it can be used for research purpose as well. Okay. So this is the way ICT is being used in health information system. We'll see about the ICT tools that are being used. First is that the importance of ICT in his is that health records, electronic health records. So this is the basic way of collecting the data, where the patients reporting to the hospital will be collected with the data, with these basic data like primary data like his name, age, area, father's name, mother's name, any complications he has already, or whether the family has any any disease earlier. So all these data will be collected, and that will be stored as the electronic health record. And that will be stored as electronic health records. And the second thing is that telemedicine and telehealth. Okay. So this telemedicine and telehealth plays a major role in clinical decision support systems. So what does clinical decision support system means? It uses the algorithms and medical knowledge for assisting the healthcare providers in giving the clinical decisions. For example, like you may have in your browse, if you are not well, and if you are going to an hospital and taking any lab tests like blood test or any screening test like CT or X-ray or anything, once you have taken these things, you will be given with the username and password. So once they are done, you need not go back in physical to get the reports. It is available in the web itself. So you can collect the data from your place also. So that is one way, that is telehealth. And telemedicine is like connecting to your doctor from the remote place. So as I am connected to you right now, like the doctors will be there in their place, and the patients will be in a common point or in their home or anything. They will be provided with the video assistance so that the doctor can examine the patients through video, and then they can give the medicine. They can prescribe the medicine. So that is said to be telemedicine. Apart from that, remote monitoring of vital signs and mobile health apps also available for telemedicine. And next thing is that health information exchange. Health information exchange in the sense that sharing the patient information among the healthcare providers for improving the patient status. So for this only, the health information exchange is being used. And next is that we have the medical imaging. So the biggest what is that? The biggest boom we have received is that the medical imaging, where we can see our status visually, in the sense that initially the doctors were assuming our health condition based on our pulse rate and body temperature and everything. But nowadays we are gifted with these PACS, that is picture archiving and communication systems, and radiology information systems, where we can see the inner organs like the bones, the flesh, and the blood and everything. So that can be seen, and based on that, the doctors can take the action over the patient. So that is another importance of ICT. And we have the clinical decision support systems, where anyone can access the data, and they can find themselves. Say for example, simply if your blood count is low, then if you type in the website, then you can find that say my HP count is 7, something like that. Then automatically it will give you that. So what is the statistics for the for how much should be the blood count for women, how much should be the blood count for men, and everything. And then automatically it will suggest you, so what will happen if the blood count is low, and also how it can be improved. Okay, so that also we can get it from the system directly. So apart from that, we can have the IoT, small IoT wearable devices, so that can be used for remote monitoring and early disease detection. So the thing, the concept behind this IoT and wearable device is that so nowadays we people are using with smartwatches, where you can detect your pulse rate, we can detect your heartbeat, and also the number of steps walked or health related activities we are having. So that is also with the help of the ICT only. And next is that health education and patient engagement. So nowadays we have many websites and mobile apps. So apart from that, we have online communities as well, where the patients are being educated about their health conditions and self-management. Like in the communities, you can just post like, so I feel so dizzy today. What could be the reason? Something like that. So there will be many persons who will be assisting you in getting back to the normal state. So that is it to be online communities. And all these things are not a single subsystem. It's actually a sequence of process, and that is it to be the supply chain management. So the supply chain management, actually how this is being done means, I can say you an example for the pharmacy. So in the pharmacy, we may run out of the medicines, but running out of medicines running out of medicines may be solved with the help of this ICT tools. Like you can have the list of available stocks in the pharmacy, and you can get the requirement for the particular pills, and then you can check with the existing stock. If it is less means, then you can order in advance. And how this is being done means with the help of the past records. Like say for example, last week paracetamol is being sold for 1,500 people. So this week also you can expect to be 1,500. But this week we have stocked with 1,500 pills, but you are running out of stock for 500 pills means, then for the forthcoming week we can stock for 2,000 pills. So likewise, it's a sequence action. So that is it to be supply chain management. And we all know this robotics and AI in surgery. So nowadays we have the AI assisted surgeries, and that is also being commonly done in many of the major hospitals, okay, for heart transplantation and everything. Because some cases we cannot handle, the doctors cannot handle by themselves. So they need like where you have minute operations to be done, or where the speed of the operation is required, then in that case they are assisted with the robots and AI based surgeries. So next data is the genomic medicine. So this genomic medicine always being used as the main parameter for prescribing the data for prescribing the treatment for the patients. Okay, for that the ICT tools plays a very crucial role. Thereby, it stores the vast genomic data set. So based on the patient's past history and his historical data, he may be advised with the proper treatment so that the recovery is very fast and also the patient fatality rate is reduced. So that is the purpose of having genomic medicine. The genomic medicines cannot be stored in the manual way. Only ICT tools are required for storing the genomic data sets. And finally, we have the public health surveillance. So this public health surveillance is mainly used by the public health department of the government, where the public major health threats, infectious diseases, and then chronic diseases. So all these things can be diagnosed and also analyzed for solving the problems. So this is the sample where we have the role of ICT in telemedicine. So we can see that we have the telehealth platform and electronic health record where you can post your comments and then you can get the information, necessary information, everything from the telehealth platform. And then practitioners and patient and practitioners mobile access. So this is another application where the patient and the practitioner will be synchronized with the mobile device, and the mobile will be through the mobile, the patient and the practitioner will be discussing each other. So here you can see that the patient telemonitoring device and mobile applications, where telemonitoring and mobile applications, where the patients will be in the remote place, and using the telemonitoring devices, his vital parameters will be measured, and from the remote place, the patient will be advised to have the treatment. Okay, so that is telemonitoring. Through the help of telemonitoring devices, the vital parameters are being measured. And then here telehealth platform for educational purpose by video and web application. It means that it is also being used for educational purpose. So not only for patient or hospital purpose, they are used for educational purpose and also for research purpose. And here you can see that this is a cycle that goes in, like using the tele-monitoring, the vital parameters are being collected and then will be given to the tele-tracking. And then here you can see that the hospitals will be will be maintaining the health record, and then second opinion and tele consultation can be done through the hospitals from the remote place itself. And then the tele-diagnosis can be done with the help of the healthcare facilities. So this is the major role of ICT in telemedicine. And this is the sample case study. So where the role of ICT plays a major role in stockouts of medicines in Tanzania. So here we can see that the graph shows the stockout of medicines for a day, several times a week, once in a week, several times a month, once a month, almost never, and never. Okay. So the sample has taken 20 participants, and out of this 20 participants, only less than 5%, like around 2% feels out of stock every day, and around 5% feels several times a week, and once in a week around 2%, and then several times a month will be around 6%, and once in a month will be again 2%. Almost never is around 6%, and never is 10. Sorry, never is 0. Okay, so it means that it never runs out of stock for any one. Okay, so the role of ICT here is that so it maintains the requirement. Okay, so how much pills are required, so what is the medicine company required and everything, so all these things will be maintained, and then all these things will be maintained. So based on that, the stocks will be filled out on time, so that the participants will never go out of stock of medicines. So this is the sample case study that is being done in Tanzania. And another case study is that so the benefits of EMR and EHR digitization in Singapore. So the users are being categorized into patients, providers, and payers. So the patients, according to the EMR, the patients are easier to read, and patients feel easier to read to understand. The electronic medical records will be easier to read to understand, and then the electronic health records will be used for better diagnosis and treatment. Personal health records will be the personal wellness management for the patients, and remote diagnostics reduces the duplicated tests and referrals, and remote monitoring makes the patient-centric integrated care, and then the telecare represents the access to specialist care. M-health applications will be the greater patient engagement and saves time. Like he need not to wait for the labs to give the results. Actually, when he has the mobile application for the labs or anything, he can just check in the mobile itself. And then analytics may be used for accurate diagnosis and better treatment for the patient. And according to the providers, EMR will be the provide easy storage and retrieval, and then improved efficiency and productivity. Electronic health record used for coordination and informed decision making. Personal health records for consistency of information. Remote diagnosis for easy access. Remote monitoring for reduced emergency and readmission. Telecare improves productivity and reduces burden of healthcare resources. M-health applications are for proactive and targeted care, and big data analytics improves the diagnosis and accuracy of the treatment. So with the help of in the point of payers, it always focus on lower cost and also easy access. So that is the major goal for the payers using the ICT tools. So coming to the SWOT analysis on e-health. Okay, so because we cannot always say that e-health is a powerful tool. E-health will provide everything. E-health will be the root cause for all the analysis and control of fatal rate and everything. But still itself has its own weakness and also the threats. Okay, so we'll see about the SWOT analysis for the on e-health. So the strengths are, we have the automatic data collection. We need not exclusively we need not exclusively go for data collection for this. So whenever the patient comes in, you record the data. So that comes the data collection. And next is that personalized medicines. Okay, so based on the data collected, personalized medicines can be given to the patients, and then the patients can be monitored through the use of artificial intelligence and other e-health applications. The data collected is standardized and can be used as a benchmark for further data collection. So these are the various strengths of using e-health. Coming to the weakness. Okay, so the weakness is that the infrastructure required for e-health is highly underdeveloped. Like we need to have a proper infrastructure for managing and maintaining the e-health records. And there are high chances of data privacy to be compromised. Once you collected the data, you need to protect the data. As we all know that we have the ethical issues, the data pertaining to the patient should not be disclosed to anyone, even by the hospitals. Okay, so but data privacy is a big challenge when it comes to e-health and the ICT tools, and exchange of data could lead to data duplication and other complications, like the data will be transferred from one hospital to another hospital for patients further treatment. In that case, if suppose any malfunction occurs, means then it may lead to wrong decision of treatment, and that is the major weakness in the e-health. And the data availability on active diseases is highly limited. Okay, so we don't have enough data for analyzing the active diseases, and that can be overcome. Actually, that weakness can be overcome. Coming to the opportunities, the workload of the doctors will be reduced, and also e-health tools for drug development will be emerged. And then emergence of artificial intelligence also plays a vital role in e-health. IoT and other usage of convolutional neural networks is also being encouraged as a part of the e-health. So with respect to the threats, so the major threat is that there is no validated e-health tool. Okay, so anyone can use smartwatch, anyone can use pressure checking device, but there is no one to validate whether the data given by those devices are true. Okay, so they are correct. So that is the major threat. And also once they give the wrong measurement or the wrong impact of the health of the patient, the patient may go with the psychological problems. Like he may think that he is having a severe disease and he cannot come out of it, it cannot be cured or something like that. Like that, they may overinterpret their mental state, and it may also cause serious issues. So that is the major threat with this e-health problems. So with this, we can conclude that the ICT tools or the major role plays a major role in the healthcare industry, and also with this ICT tools, we can do lots and lots, and the data available from the ICT tools will be very much useful for both the management, hospital administration purpose, and for the research purpose, and for the government also for taking the decisions and policy makings. And these are some of my projects that are associated with the ICT tools in hospital information systems. So my first project is that automated deep learning framework for COVID disease detection and analysis in Southeast Asian countries using computer tomographic images. The co-investigators for this project are Dr. Fetri Okyu from Malaysia and Dr. Inge Dhanmati from and Sifa from Indonesia. So actually in this project, I'm going to take the ICT tool as the medical imaging, where I'm going to take the lung CT image. With the lung CT image, I will be checking whether the patient is. My second project is telemedical diagnosis. In the telemedical diagnosis, I have developed a medical sensor kit where the sensors will be placed as via wearable devices to the patients, and the patients will be in the remote place. And from the remote place, the vital parameters will be calculated, and that will be transferred to the nearby hospital, that is our SRM hospital. And from the SRM hospital, the doctors will be validating the vital parameters, and based on the parameters received, they will give the treatment from the SRM hospital itself. So this is the model for the telemedical diagnosis. Here we have the village kiosk center. There will be one kiosk center at the village with the medical kit, and there will be one person who is trained for using those medical kits, and then the person will be taking up the vital parameters of the villagers and then the vital parameters will be shared through mobile apps to the SRM hospital. The doctor at the SRM hospital will be validating the vital parameters, and then he can prescribe the medicines to the village kiosk center, and the representative at the kiosk center will be distributing the medicines to the villages. So thereby the rural people, rural people will not be is not required to come to the hospital for getting the treatment. They can get the treatment from the place where they are. So the major thing is that here we can do treatments for only the basic diseases like fever, diarrhea, and cold and everything. So for major diseases, the patients need to visit the hospital only for further treatment. So I have these patents on my account. So with respect to ICT tools in medical imaging, so in medical health. So first is that the system for heart attack prediction using IOMT with deep learning algorithm. So the chest strap is a wearable device where it maintains the where it measures the pulse rate and the palpitations present over the patient, and then it will inform the nearby neighbor's mobile number, so that any immediate attention should be taken care will be taken care by the known persons. Okay, so that is first one. And next one is that profile-based digitization of medical records in cloud. So as data privacy becomes a major threat to the e-health records, I have designed a profile-based digitization, like where the patients will be accessed only based on the ID, digitization ID given to them. And with that, the records will not be tampered by any other else. The records will be highly protected. So it's an Australian patent. So these are my ICT works in healthcare information system. Thank you.
Okay, thank you, Professor, for giving us informative and interesting presentation. Okay, there are a lot experience, and I interested with the analytic data, Professor. We know machine learning with a lot of algorithm, supervised learning for prediction can be analyze data from the database. Yeah. Jadi database in hospital is very important to analyze the disease, like to accurate diagnosis and the others. Okay, okay. Ladies and gentlemen, now come to the question and answer session. I would like to have a question maybe from the participant. Please can maybe, okay, a question from ladies and gentlemen. Can you have a question? Okay, that's okay, Mr. Yusuf. Yeah. Okay, can you mute?
Thank you. What are the challenges to implement HIS in hospital in your country, and how to overcome them? Thank you.
Challenges in implementing?
What
Can you
are
repeat
the
again, Mr.
challenges
Yusuf?
to implement HIS in
Oh.
hospital in your country and how to overcome them.
Okay.
So the major threat is the data privacy. So the data privacy, when we go for official data collection, we are not provided with the data because of the ethical issues. And when when the data is being when we are not using it officially, then in that case the data will be hacked. So that is the major problem associated with this e-health records.
Okay. Okay. Any question, Mr. Yusuf?
I think that's all. Thank you.
Thank
Okay,
you.
thank you. Okay, thank you. Okay, two question more, maybe from the participant. Okay, please. Hospital information system is a complex system that implemented in hospital. We know in the hospital information system a lot of module from registration patient, kemudian billing and billing system and the others. In India, how about Professor?
Could you please repeat the question? I was concentrating the question in the chat box.
Okay. Okay. Maybe check box. Okay.
About the beyond patient records, what other areas of hospital administration are impacted by hospital information systems? Yeah, everything like the scheduling of patients. Okay, how if it is a multi-speciality hospital with a more number of specialized doctors, there we can have the scheduling app so that they can schedule the patients accordingly. So each patient may be given a half an hour time, so that one person will be admitted at one time and the next person will be admitted at half an hour time. So this can be done for hospital administration. And in other words, if you go based on the number of patients arrival to the hospital on per month basis or per week basis, the data can be analyzed and it can be used for the improvement of the administration. Like if the number of patients are increasing means, then the infrastructure should be increased, like the number of beds or the number of doctors, number of staffs. So those should be increased to provide service to the patients. If the number of patients are reduced means, then we have to analyze why the patients are not coming to this hospital, where they are going, what other requirement is needed for the patients in this hospital. That should be taken care for that purpose. This next, Alfina.
Alfina Aisatus ada from STIKES.
To implement yeah, that is mandatory. We need to provide the record. It's mandatory here. Mandatory rule in India. Well, how about here? I would like to know.
It is mandatory also.
Mandatory also. Yes, fine.
Iya dah. Oh yang bab satu ikut tak? Oh yes, benar.
Okay.
Mr. Amir, I want to
Oh yeah.
question.
Yeah, Mrs. Titin.
Professor Niranjana. Development ICT needs digital health literacy, both doctor, nurse, others, officer, and patients also. In your point of view, which one comes first to be elevated in digital literacy, society, or health workers?
Health persons or
Development ICT needs a digital literacy both on patients and health workers. in your point of view, which one comforts to be elevated in digital literacy, society, or health workers?
Yeah, I guess health workers only. Health workers will be given the priority for that.
Thank you.
Thank
for
you.
your answer.
Okay. Once more question maybe from the participant. Okay.
Permission to ask about the
Okay, maybe any question from the participant? Okay. I want to ask the question, Professor. We
Yes.
know in Indonesia
Mm.
has a system for health insurance.
Mm.
The name of the system is National Health Insurance.
Okay.
How about in India?
We have several insurance, like we have life insurance corporation by the government. Apart from that, we have many private insurance agencies available. Only one government insurance, that is Life Insurance Corporation of India. This is the government insurance company. Apart from that, we have many private we can have.
Okay.
The health policies differ for different private what is that, insurance agents. We cannot take the same for according to our requirement. We can take the health policies.
Okay. Okay. We know in insurance system maybe can file calculated from the billing system. How about in India? A fraud system of insurance in heart record or others?
Actually, we need to pay some amount every year or every 6 months, and that will be taken for that particular year, and the claim will be based on the use, like how much, like how many times we visited hospital, and based on that we will be fixed with a limit, like some 30 lakhs, something like that. Only for that amount we are allowed to claim. After, beyond that, we are not allowed. And also we have the policies for which and all we can claim. Only for those we can claim.
Okay, it's a good good system.
Yes, it's
Okay,
actually a tricky one. Actually, I should say that it's a
okay.
tricky one for the profitable for running the
Profitable.
insurance company profitable in that way.
Okay. Okay. Okay, maybe any question again from participant?
Pak Amir, excuse Pak Amir.
Okay, Mr. Jamal, go ahead. The question.
Pak Amir.
Yeah. Yeah, go.
Halo.
Yeah. Yeah, hello.
Terdengar, Pak?
I'm here.
Pak Niranjana, Ibu Niranjana, halo.
Hello.
Okay.
Hello, Professor.
I have some question. I have any question. Hello.
Yes, you are audible.
Okay. You hear? You hear me?
Yes, I can.
Okay. I have a question. This the problem of SIM.
Street.
Yeah, of SIM perform the SWOT analysis.
Yeah, what is the
Informasikan,
question from
is
the
this
SWOT
help
analysis?
information? Jadi, apakah informasi kesehatan ini yang paling banyak masalahnya? Jika dilihat dari SWOT analysis, ancamannya bagaimana ini kalau itu terjadi? Jika ditinjau dari SWOT analysis.
The treat.
Paham, Pak? Aduh, oke.
The treatment.
Treated.
The treated of the.
The threatening the problem of sin. Yes. Thank you, Mr. Niranjana.
From the SWOT analysis, Professor.
The major threat is that there are many e-health devices available across countries, but there is no one to validate the results obtained from the e-health devices. So as such, it is giving some value and we are believing it. There is no validation for the particular device. So that is a major threat.
Oke, terima kasih Pak Amir sampaikan.
Oke, thank you Mr. Jamal.
Yes, terima kasih.
Oke, thank you very much. You're welcome. Terima kasih Ibu. Oke.
Professor can speak Indonesia.
Only selamat datang and terima
Selamat
kasih.
datang. Oke, terima kasih.
Ya, terima.
Selamat pagi, Ibu. Morning pagi.
Good morning. Selamat pagi.
I thought it is welcome.
Okay.
Greeting.
Greeting. Okay, it's interactive. It's very nice, Kestekjuran. Okay.
So I am happy to meet you all. Thank you so
Yes.
much for giving me this opportunity.
Okay, Bu Titin, Mr. Titin. Hello.
Mrs.
How many days you have to do?
I'm leaving by Sunday from Surabaya to Banyuang.
Oh, Surabaya to Banyuang.
Till Saturday, I will be available here. Tomorrow.
Okay. Tomorrow, okay.
Professor Niranjana, can I ask one more question?
Yeah, please.
Indonesia has launched a blueprint for health. Indonesia has launched a blueprint for health digital transformation for 2021 until 2022.
Excuse me, Titin, you're not audible.
Indonesia has launched a
Tax launch.
Launch. Yeah. Indonesia has launched blueprint for health digital transformation.
Okay.
So could you elaborate more about the journey development?
Blueprints.
Yes.
The journey development.
In India, we have the blueprint as like. In India, we have the blueprint as like the essential parameters need to be obtained from the patients because of ethical issues. So only the necessary documents like primary documents like name, age, address, and to be obtained from the patients, and it should not be shared to anyone, even for the research purpose and for other activities. So, like even if you want to have the vital parameter details of the patient's name, age, and address will be hidden. Identity will be hidden, and the rest of the things will be shared to us.
Okay.
Sharing data patients from hospital to hospital or from rural village people like primary health.
Sharing data patient.
Yes, sharing data patient.
You're not audible actually.
Sharing data patient.
In Indonesia, we're starting to sharing data patient from primary healthcare in rural to hospital.
Oh,
I can't hear it.
sharing, Mrs. Titin, sharing data passion. How about in India?
That's what
Maybe.
I said. Identity information will be hidden and it will not be shared to all, only to the public health workers and also any distinguished researchers in the particular field. For them only the data will be shared. For others, it will not be shared.
Okay. Okay, Professor, this is
Seperti yang
okay. The question from Mr. Muhadi, which is more advanced in managing hospital information system in India, government versus private?
Private.
Private.
Government is not that much well equipped. Private is more.
Oh, okay. And the question from Ahmad Solihuddin, excuse me, what are the challenges in implementing a hospital information system? The challenge implementing a hospital information system.
In implementing hospital information system, the data storage. We need to store the data in a secured manner. So that is the biggest challenge. And retrieved whenever required.
Yeah. Data storage. To database.
Yeah, database.
Tadi sudah dijawab Pak Amir punya saya. Oke.
Oke,
Terima kasih.
itu Mr. Jamal. Oke, maybe enough, Mrs. Titin, or there are a lot of time.
Okay. Thank you, Mr. Amir, for guiding discussion about the importance of hospital information system. And next, we are going to hand over e-certificate virtually to Professor Niranjani. Mas Bubu, please share screen. Mas Bubu, please share screen e-certificate for Professor Niranjani.
Thank you.
This is certificate for Professor Niranjani. Thank you.
Thank you.
For having us the importance of hospital information system.
Thank you very much.
Yeah, hopefully we see you in next year.
Yeah, of course, you also visit India. You're most welcome.
Oh, okay.
Thank you. Thank you.
Maybe next time can join research with Professor Govindan Niranjani.
Yeah.
Okay.
Okay.
For participant, the certificate of the seminar, the committee will send through your WhatsApp group. And ladies and gentlemen, for the documentation, we are going to have a photo session. Mas Bubu, please be prepared. Because we have 1,080 participants in this event, so it will take about 5 minutes to take a pictures. Our committee will take your picture in every screen. Please give us your best smile.
Can smile, please. Thank you.
Mas Bobo, let me know if you're done.
Okay.
Clear?
Done?
Finish?
Finish. Okay.
Thank you.
Thank you.
Thank you, Prof.
My-
Niranjana.
Yeah.
Okay.
Thank you.
Honorable
Thank you.
distinguished guests, ladies and gentlemen, this is the end of our event. The committee would like to thank all to Professor Niranjana. We are very much appreciating
Thank you,
that you
Madam.
are joining us today.
Thank you.
Thank you. Thank you.
Ladies and gentlemen, we hope you enjoy our guest lecture today, and thank you for being
Thank you.
a beautiful participant, and hopefully see you again real soon. Thank you very much.
Thank you very much,
Okay, thank you.
Professor.
Thank you,
Assalamualaikum.
Professor Niranjana.
I am leave.
Waalaikumsalam.
Thank you, Dr. Ame.
Thank you, Professor.
Thank
Yes.
you, Professor Titin. Thank you. Thank you
Thank
so
you.
much.
Yeah. Have a nice day in
Thank
Bandung.
you.